going to talk about the spine, we're going to talk about spinal anatomy, and a lot of other things. So if you have any questions, we can kind of ask as we go. If it's like a really specific, detailed one, I might put it to the end. But yeah, we'll just get started. So we'll get started with these. Wrote down all the different systems in the body. There's a lot of them. They're all interconnected in terms of but the spine really affects like every single one of these other systems. And the spine is so important. The brain houses, or not the brain, the skull houses the brain, and that's the bony structure houses the brain. The brain's obviously really important. But your spine houses your entire spinal cord, and then all your nerves, which is on this exit out of the spine. And so your spine is really important because it has to be stable, but it also has to be flexible. So because otherwise, if your spine wasn't flexible, it would be like kind of like we're all like pogo sticks, basically. So the shape of the spine is super important, and how it functions is really important. And it's the center, like if you can get this cueing for the spine correct in yoga, that makes your class safer, it makes it more beneficial to people. But a lot of times people's posture, like if they can't get into the right posture, a lot of times it's because of like weakness in the spine or inflexibility in the spine, and always cueing from the spine. You have in the spine, and what it's made up of, you have bony structures, which are the bones in the spine. And then you also have the active structures, which are like the discs, which are the padding between the bones. And the discs look like they are made out of like spongy material. They have more water in them. They're cushioned, like if you think of like almost like you would put extra padding in your shoes. That's discs. Discs are the padding between the bones. So you'll meet people and they'll have disc issues. What does that mean? And we'll talk about that. And then in between each of these bones, so you have 24 movable bones in your spine, and they're made up of the 7 cervical bones, and then those sit on top of the thoracic spine, which is 12 bones, and then the lumbar spine, which is 5. And then they all sit on top of this is your sacrum, which people have heard of. And then that transitions down into the coccyx, which is like your tailbone. And then this right here, these are your SI joints, your sacroiliac joints. And these are your true hips, like when you're like, what size are my jeans? That's these hips that right here. And then this is where your hip, like your ball and socket. Like, so when people get hip replacements, this is the hip that they're replacing. People talk about their hips in 2 different places. So they talk about like back here is like hip, but this, like if you're like, I know somebody who had a hip replacement, the hip replacement is here. It's at the ball and socket joint. That's there.
They don't take the whole hip out, just that little section.
Correct. Yes. They will, and it just depends on like the severity, but generally, like if on an X-ray, a new hip is look like a metal ball in there. So a hip replacement never messes with like back here. It's all here. Okay. And the surgery, you'll get people in your classes with hip replacements if you teach an aging population, and they always go in through the front or through the side, never through the back. So, and there's a lot of like common misconceptions about where replacements happen. So that's this, and then so between each of the vertebrae are holes, and those are the spinal nerves that come out. So you've got your like the brachial plexus is going to come out, and it's actually on this model. This is just the cervical spine. So I'm trying to stay in the view of the camera too. So this is skull. This is the back. Okay, these are the bony things that you feel down your back. That's your vertebral. That's the vertebra. And this is the brachial plexus. And so these are all the nerves that basically make your arm move. Like if something cuts these nerves, this arm isn't like gonna move. So this is the brachial plexus. You also have a lumbar plexus, and that goes into your legs. That's from your low back. And we'll kind of come back to this structure in a minute. But if you'll notice in the spine, so you have your skull, which holds your brain, you'll notice that the vertebrae in your cervical spine are smaller than those in the thoracic spine. And this is like posture or important for like how our weight is stored. So like the cervical spine only needs to support the weight of the head. So the bones don't have to be as big because it's mostly just to support the weight of your head. Your head weighs about as much as a bowling ball. Okay, so 8 to 12 to 15. I mean, people have varying sizes of heads. I will let you know. And then, and the cervical spine supports that. And so then your thoracic spine is a little bit bigger because it's supporting the weight of the head and the weight of the cervical spine. The thoracic spine is interesting and it's shaped a little bit different because off of these right here come your ribs. So, and your ribs start really high actually. So this is a good example. These are ribs up here. So this is cervical vertebra 1, though how they're numbered is like 1 through 7. So 1, 2, 3, 4, 5, 6, 7. And this, I didn't know if this model is anatomically correct. So I was counting and I was like, oh, I hope this is right. This is T1. This is your first thoracic vertebra. And that is actually your first rib. And that makes your first rib like really high. And people don't think that their ribs are that high. Like nobody ever, most people are unaware of like how high your rib is. And it's actually like, if you push down in this area of your neck, that's like actually your first rib. Or if it feels a little bit painful, I can come around and push everybody's if they want. So these ribs come around and they attach into the sternum in the front. And so, and everybody has about 12 ribs in this kind of, we'll get into the rib placement in a minute, but some of them, the first 1 through 8 come around and they attach into the sternum. And then you've got some floating ones down here and some false ones that like don't come around at all. And so the thoracic spine, because of its function and the function of the ribs are to protect the heart and the lungs. So that's like what this is like going over. So the thoracic spine inherently is not as movable or moves in different ways than the cervical spine because it has more like things attached to it. Anytime you take a deep breath, you're impacting the thoracic spine because you're moving the ribs, you're contracting and expanding the rib cage. So it's also affecting the mid back. Then you have your lumbar spine. Your lumbar spine has 5 vertebrae, and they, as you can see, like get larger as you go down because that's what's holding the weight of your body. And so this is more like core like think stability. They're just bigger, they're denser bones because more weight is like sitting onto them. And you also have muscles that are intrinsic to the spine that are just like, there's muscles that are intrinsic to the spine that just go within that structure. And then there's muscles that come from the legs and even attach into the low back. The only 2 named vertebrae in your spine they're mostly just numbered. Remember how I said that? So C1 is at the very top, T1 is the first thoracic. But the C1 at the very top is called the atlas, and the C2 is the axis. This is not as easy to see on this one, but they're just like differently shaped than all the rest of them. And that they allow at the top a lot more range of motion, like in terms of like rotation happens up at this very top, the C1 and the C2. And so that's why they're like angled or they're shaped a little bit differently. Also the brainstem like sits right up in that cervical one. So then you'll find chiropractors most specifically that only treat like upper cervical, and they only do treat those first 2, the atlas and the axis, because of its placement near the brainstem, and that's all they treat. So you've got the curvature of the spine is really, really, really important. when you're born, so I'll talk about like normal alignment, and then we'll talk about how that develops, and then we'll talk about kind of how that fails. So you have a cervical, so normal, neutral, let's call it ideal neutral posture. This is mountain pose, also as all of this, where you see ideal neutral posture. You should have a nice cervical curve in your neck, and that's called a lordosis. In your mid back is a kyphosis, and that's, so the thoracic should be a kyphosis, and that's kind of more like, think like a cat type of motion. And then you have the lumbar should also be a lordosis. So you should have a lordosis in your neck, cervical spine, and a lordosis in your low back. And then the thoracic spine should be a kyphosis, and then naturally the sacrum is a kyphosis. So why that this is like important is because you'll notice that people, like as they age, mostly you'll see that they start to like lose these curves. So instead, like if a person has a nice like lordosis in their neck, this D1 should be aligned with this, so with the C7 or over the shoulders. So, and we'll talk about ideal neutral posture in just a second, but C1 through C7 should be on top of each other. A lot of times when people start to have poor posture, the neck goes forward like this, like they lose the curve in the neck. The shoulders round forward, right? So like in yoga, you're always like cueing, like bring your shoulders back and down, lift your chest towards the ceiling. Like why is that like kind of a constant like cueing that's happening? Is because naturally, as you like accidents, injuries, trauma, age, gravity, your neck goes forward, your spine rounds, and you get a bigger kyphosis, and then you lose the lordosis in your low back. So and that tends to look like it flattens out. And I'll chat about, you can also have an exaggerated like lordosis where like the curve in your back is like more, you can have, so there are people that are hyperlordotic. Hyperlordosis is oftentimes seen like in pregnancy also because of the way that gravity, the weight changes. So like, and this how will happen in people with like larger stomach, like who carry weight around their middle. But when your stomach goes forward, or even in a back bend, that's a hyperlordosis. So some people are like have more of a hyperlordosis in their low back, and they generally have more instability. So maintaining what yoga can really help people be aware of their posture and change how their posture curves are based on cueing. So like a lot of times people, unless somebody points it out to them, don't realize that they're like this, right? Like, or they walk like this, especially like older people. Like that tends to be like what starts to happen. So to me, yoga helps gain a body awareness that helps support good posture. And all of the cueing that you teach with yoga is cueing into good posture. So that's really helpful. The way that your spine develops is you're born like newborn babies. Like if you think about like newborn babies, some people have more experience with those than others. They are like more of a kyphosis. They're born with a kyphosis. They're like curled up. That's how they were in utero. They're curled up. Okay. And so the first curve develops as a lordosis, and that's like tummy time, babies in tummy time. So just laying on their stomach and lifting their heads. Some babies love it, some babies don't care about it, and some babies hate it. I guess that's like really the only three things that everybody feels about everything. But tummy time is a thing. But developing the cervical lordosis happens then. So it happens in tummy time and on the floor. So like cobra pose is like a way to help people like it's hard for people. Cobra is hard for people if they're doing it correctly. But that's like basically the development of cervical lordosis. The thoracic spine stays in a kyphosis, which is how you were born. And then the lumbar lordosis develops when babies start to walk. So that's how it works. And the ribs that I was talking about, it says the true ones, and they're true because they attach to the sternum. And then the false ones, 8 through 10, like are here, like if you feel the front of you. And then the 2 in the back are just like little offshoots off the back.
Why are they called falls?
They don't attach to the sternum. So they don't.
So everything attaches to the back of the spine,
Everything attaches to the
but
back.
only the first
8.
attached to the sternum, and then the ones below are called falls.
Correct. Yes, and 2 of them, and you can feel them on yourself. These ones that like are down here are like, they're false because they don't come in and attach to the sternum up here. So like they attach to each other. It's harder to feel like the 11 and 12 because they're in the very back. They don't come around normally. But this like bottom of your rib cage, if you can feel it, those are false ribs. So let's see what the next is. Oh yeah, it's important. So in terms of like when you're looking at people, like where are things located? C7 is so on yourself, or you can look at it on other people. But if you ever are like, why does this one bone in my back stick out like a bunch? Is that normal? Yes, that is normal. And it's the vertebral prominence, and it's about C7. So it's your last cervical vertebra. Is that one that's like, are you kidding? Like, why is this so big? Is this abnormal?
Am I getting a hunchback?
Am I getting a hunchback? Exactly. But if you just have one that sticks out, that's generally it. Your scapulas are your shoulder blades. Scapulas are the technical name for the shoulder blades, and they're behind you, or they're back here. And they like are in your thoracic spine. Then this is that 12th rib that we were talking about. The iliac crests, which are like your true hips, like when you're like measuring for your jean size, that is about the area of L4 in your spine. So that's like about almost the last lumbar vertebra. And so in your spine, you can also so this is an ideal spine. There's no issues with the bones, no issues with the discs, no issues with anything. What can happen in your spine, so with your discs are padded, they're spongy, they're made mostly of water. They also have some like fibrocartilage properties. They're different in the middle than they are on the outside, but they're intended to be shock absorbers, like when you run or when you jump or anything like that. So discs can start to have issues, and they can get like bulges in the discs, which like the inside gets like, and that's like a bulging disc, or like people will be like a slipped disc, which is not like truly anatomically correct, but it generally generates like pretty sharp pain for people. The other thing that can happen is these discs can like extrude actually, and they can touch these nerves. They mostly do this in the cervical spine or the lumbar spine, and this sends sharp shooting pains down your arms or your legs. Okay, generally. It can happen in the thoracic spine, but it's less common. And sometimes those cases are surgical, sometimes they're not. If they press on the cord, if they're pressing back here on this back part on the actual cord, you get really weird symptoms because like your spinal cord goes to more than like one area. But it can also be out here where it's pushing on the nerve, and that is like shooting, like I said, the shooting pain down the legs or numbness, tingling, weakness. It can also happen in your arms as well. The other thing that discs can do is they can, instead of staying nice and thick, they get smaller and they get thinner. So the only way after your age 25, your discs become avascular, which avascular means they lack a blood supply. And the only way that they get motion is by a process called imbibition. And that's just a fancy word for like movement. So like moving helps the health of the disc. And after 25, it's the only way to get nutrition to the discs is motion. And so that's like another really important thing with yoga, like this woman who's like lives till she's like 100, and she's still able to do like crazy postures and stuff like that. Like her whole life, she's probably been moving really well and like in a way that is like good for the discs, because your discs also, like, people, as you age and you have less water in your body, they shrink with time. So they shrink as you age. So that's like why one of the reasons like that people as they get older get shorter is because these count for, I want to say 25% of the spine's height is from the discs. So if these get shorter, sometimes people experience that as they age and all of their spine gets shorter altogether. But sometimes, and it's mostly based on injury, is that you get just specific discs that get smaller. So yoga is really helpful because it helps put good motion into the spine. You guys all know that. That's why you're here. Yes.
You said they're very full of water.
Yeah.
So if you're dehydrated, does that affect them?
It won't. It doesn't like affect them. It's not like just because you like drinking won't make it different, but they just have a high water. There's a high water content.
So you can't say something backwards, drink more water.
Well, you can, and I would still say that, but for different reasons.
Okay.
Yes.
I was having that same question, so that kind of made me wonder. Then, would like, say, like some people take like mineral supplements? Would that maybe?
Yeah, I mean, like, I think that those, like, you can't be like take that to target that.
Or I guess a better question is
Yes.
like how the muscles, things come in and things come out. Is it the same way with the discs? They can, like, we can add, even though it's like as we age, we're losing.
Well, if they don't have a vascular source, then it's really hard to get stuff into the discs, I'm sure.
Right.
Yeah.
Specifically, yes. But so it's hard to be like specifically target the discs with recommendations. So disc issues are super hard to treat because they're hard to target. But the suggestions that you've made, if you're like overall health status, like what helps you be healthier in general, like, yeah, like a good mirror. Like for me, when you ask that question, I'm like, magnesium is like one of the best like mineral supplements that you can take.
Mm-hmm.
It's good for your bones, but it's also good for your muscles. Most people are 80% of everybody's deficient in it. So that would be like the mineral that I would say. Like, it's hard, but like I said, it's super hard to specifically target and just be like, well, I'm doing this to just target the disc.
Mm-hmm.
Drinking water in general, like being more hydrated, that also affects the muscles. Like, and there are muscles that attach into the discs. Not actually very many of them, which is surprising. These discs on top of like these bones are ligaments that like run the length of the spine. So there's like we're talking about the bones and then also muscles, but then ligaments attach bones to bones. And then there's also tendons, which are muscular attachments, muscles. Tendons attach muscles to bones. So, and this is like throughout your entire spine. So anytime it's a bone to bone, it's a ligament. Anytime it's a muscle to a bone, it's a tendon. So like common examples of a tendon are like your patellar tendon. That's your patella. It's attaching, that's a common tendon. Most like times that when you have a sprain, that's mostly ligamentous. Like if you sprain your ankle, that's mostly a ligament issue. It can also be a muscular issue also.
Ligament is bone to bone, tendon is muscle to bone.
Correct. If you hear weird sounds, we have an ice maker I keep hearing things and I'm like, I forget that we have a speaker. So I'm gonna close this.
So I have a question.
Yeah.
How does moving help the health of the disc? Like, I mean, we know, right? Like, stay moving, stay active, but what is it doing to the disc? Is it the muscles around it that it's helping to support, or why would movement itself?
It's like actually almost acting like it's like a pumping mechanism on the cartilage. Like it actually like is like, oh, I would say kind of like that. Like think of it as like almost like lubricating that area. Like if this can get motion, then what's already in there helps. Like yeah. For lack of like I know that there's like a more like scientific like exactly like what it does, but like if you were like how does that happen? It's actually like within the disc, like with the cartilage getting motion. You know, like motion is lotion. Can you hear that? Like right, like but it's actually that the physical act of the cartilage like moving. Yeah. Mm-hmm.
Is there like a twisting or like forward or backward movement that's better? Or just all movement?
Well, I'll talk about like what's great question that can lead us into like what we can talk about and like what good ranges of motion are for your spine. But there's not no. As long as it's like an appropriate range of motion for the spine, it doesn't matter. Flexion, extension, rotation, lateral flexion, doesn't matter.
Or lose it.
No, seriously,
Yeah.
that actually is like,
Yeah.
and I know that's like, it's like, just kind of like cliche, kind of like when you're like, I don't know, like, how does this work, you know? But yeah, if you stop using it, you do lose it, like, absolutely.
Just don't abuse it.
Hmm?
Just don't abuse it.
So,
Yeah.
that too. So issues can happen with your discs. They can also happen with the bones. So, and arthritis. So I'm not going to actually say the word arthritis yet. I'm going to say degeneration. So let's talk about degeneration of the bones. So degeneration of the bones. So like this is a nice like healthy bone. You can kind of see where this is going, right? Like so it went from good to worse. So this is a nice healthy bone. The like those where the nerve exits is nice and like open. And so as you start to go down, you'll start to see like bone spurs. Like what's a bone spur? Like that's where like the bones, instead of being nice and like flat like this, they start to get like rough edges like shooting off of them. And then I'm going to go do a little more explanation and then talk about it from there. So then you can also like kind of, and I can pass this around too, so you guys can like actually like see it close up, is where these nerves exit, they can get more like that foramen or that hole. Foramen's a fancy word for hole. It will get more like bone growth into the hole. So that can also be another reason that like people have shooting pain down the legs, is because it's called stenosis. It's like it's a narrowing of the spinal canal where that nerve leaves. Okay, so people are like, can't like, so this is a degenerated spine. That this person has bone spurs. This person has like spurring inside where the nerve exits. Like for people like this, yoga is good for them still. Like this level of degeneration. This is also called can be called arthritis. So like so people though can have degeneration without having arthritis. So arthritis is kind of like a catch-all term that's like used for like a lot of spinal pain. You have lots of different types of arthritis. Some are systemic, like rheumatoid arthritis, lupus. That's can be a form of psoriatic arthritis. Like those are like more systemic. Like it affects the whole body, especially like the fingers. Like people have really bad fingers generally. But inflammation of degeneration is called osteoarthritis. And a lot of people have osteoarthritis. And this is like your wear and tear. This is age related arthritis. And it generally stems from micro traumas, like posture, the way that we sit, the way that we stand, the way that we look at our phones, or it can be big traumas, like big accidents and injuries, dirt biking, sledding. Oh my gosh. Some of the car accidents, some of the worst accidents I see are from sledding. It's actually shocking to me. And water skiing, snowboarding, just name all the things you can get hurt doing. Okay. But you can also fall in your bathroom. So it's like you can hurt yourself anywhere. But generally, I found that osteoarthritis mostly has a wear and tear component to it. And smokers, people who smoke cigarettes, it is infinitely worse in them. And smoking cigarettes makes like everything worse, but it really, I can see it in people's spines. Like if they don't necessarily tell me or I haven't noticed that they are, I'll like be like, do you smoke? And they're like, yeah. And I'm like, yeah, I can tell actually. Like the level of degenerate. And those are people that are generally like they're lacking maybe a trauma. Like they're like, oh, I haven't had anything like really big, and the people had some really big traumas.
What about alcohol?
I don't see it like, I wouldn't say that like you can see that as much. I just like purely notice it with smoking. Like it's long-term smokers, like older smokers, people who have been doing it for a long time. That's what
it's nicotine use, or would it be the other chemicals in?
You probably don't know yet.
Yeah, we probably don't. I just think about how
Yeah, the
prevalent,
vaping.
right? Like high levels of nicotine are for a lot of the younger population, and just curious over time, I guess like you said, we don't really know.
But like a lot of people chew too, and like I don't know that it's like I don't know. I'm not sure. It's the long-term smokers. I can see it on their X-rays. Like so.
I have a question for you on the example of the degenerated.
Mhm.
If you have somebody who's like at the second to last one or last one, can they build up the disc, or can you just only say what's there? Like if you're like,
That is
you can build
a great and a question that I ask. And so some people would say no, absolutely not. Like, no, you can't. Like once you've lost it, it's gone. That's as good as you're gonna get. So there's so many options now. So like, okay, let's just say with like straight up, like no other interventions, like just like movement and like if you can do some really targeted like movement to that area. So just on your own. I'm just saying like if you're just like on your own trying to do this, okay, no help. There's no surgeries or anything that does it. But on your own, good targeted movement and low inflammatory diet and high levels of like fish oil, glucosamine, and collagen is like your best chance at like you're gonna like do it on your own. If you're like really like how would you do it on your own? Talk to me. There's like this whole like pulley system that I need to like talk you through. But it is like motion, like there is motion that you can put into it. Okay, flexion in its flexion extension. So, for example, if like McKinsey exercises, those would be like one that, and there's probably yoga things that mirror that, but like McKinsey exercises is like would be a good one. Now, if you're talking to me as a chiropractor who's like doing this, we have a table that is a decompression table, and we're actually creating space in that area. So I'm doing x-rays and I can measure like the space changes over a series of treatment. And we're putting like 60 to 120 pounds of pressure and like pulling the discs apart. That helps to hydrate it. It's like passive motion. And I'm actually seeing visual changes on x-ray. So that's not like, I'm not going to be like, I can do that for everybody, like, but it is working for people. You can do stem cell injections. It's the only thing that's like shown to actually regrow cartilage. Like you can do it in other joints too. Knees are really popular, low backs, things like that. And then it's probably like
Corticosteroids injections.
those help with pain, but they do not rebuild cartilage.
Yeah, they would rebuild, but if there's like inflammation.
Mm-hmm. Cortisone injections cause a decrease in pain, but they also increase bone degradation. So like, I'm going to say it from a knee perspective because, so like a lot of times people have knee pain. So knees are, you've got your femur here, you've got your tibia here, you've got your fibula on this side, and then you have your, like your knee joint, and then you have your patella. And then in between the joint is a meniscus, which is all cartilage. These joints are meant to go forward and back, flexion and extension. That's the only ranges of motion they should do. So if you ever watch football and you see a knee go to the side, it's a bad day for everyone, okay? Knee replacements there's a lot of knee replacements, so I'm talking about knees. So, but they've done studies of steroid injections into knees, and it helps with the pain of the knee. So this is a really common joint to get inflamed. That's why I'm talking about it. But the steroid injection speeds up bone degradation and loss. You can only get so many of them. Like there's like, I think it's like, I don't remember. Sometimes it changes, so I'm not going to tell you how many you can get, but there's a limit. So if you look at it. And so it can cause short term, it helps with the inflammation, but there's no like regenerative properties to a steroid injection. So yes.
Are stem cell injections available everywhere, or are they only available as like a trial option, or?
Sure. So the FDA has not, so there's different types of stem cells too. So I've had stem cells in my knee. And we're not off topic in case you're like, are we off topic? So your meniscus is the padding between the knee and the tibia and the fibula, the femur and the tibia. And you can get tears in the meniscus. So I'm 40. I have a tear in my meniscus. I have a tear in my ACL. I have arthritis and like a Baker's cyst or something like that. So I did a stem cell injection, healthy live tissue, or from ethically sourced from C-section deliveries and from umbilical cord tissue. And I put that into my knee. And I have been able to run after that. I wasn't able to run before. So there's different types of stem cells, to answer your question. So we do stem cell injections here, and those are the stem cells that we use. There's bone marrow stem cells, which they take your stem cells out and they re-inject into you. That is another like option on stem cells. That could be an age thing on like how effective that is. Like an aging population, you're not going to have as many stem cells as like a younger person. So what's happening to is like people born like the last 20 years, I would say, like their parents can bank their cord blood. And so some people have banked their own stem cells like that those would be also like super viable for applications that we're talking about. The FDA has not approved them, but you can get them done because we're doing them. So, but it's the only thing that I know that like causes like tissue or like cartilage to regrow. So.
Hey, Angela. I'm online. Hi, Jeanette. Are chiropractors using hyperbaric chambers for encouraging regrowth?
Some of them do. I don't use them, but some people like hyperbaric chambers. I didn't notice a big difference. I've used a hyperbaric chamber. Has anybody used a hyperbaric chamber? Is everybody local besides Jeanette?
But there is one where I see it for wound healing, like
Yeah.
and dialysis
Mhm.
seems beneficial for that, but that's
Yeah.
the only thing I know.
I say some people like mold toxicity and stuff like that. Like hyperbaric chambers are like really great for that. I used to have a hyperbaric chamber. I didn't see a ton of benefit, but I don't know really what I was looking for. You know what I mean?
Yeah.
But I think they can be. I've seen them really beneficial wound healing, mold toxicity.
Okay.
So and like other like lung issues, oftentimes. Yeah. So there's a place here if anybody wants to try hyperbaric chambers that are not very expensive. Is Alpine Wellness. It's on Glenwood. They have like hyperbaric chambers, infrared sauna, float tank. They have IV vitamin IVs. Those are expensive. Okay. Sorry. Was that all your question, Jeanette?
Yeah. Thank you. I was curious. I haven't used it yet, but thanks.
Yes. Sorry. I'm like, yes, I don't know your name. What's your name?
April.
April. Okay.
So I just wanted to let you know that when my knees, I got them done at the same time, no cartilage in the left bone on bone, barely any in here, and the kneecaps were kind of to the side. So here in Idaho, he offered, do you want to do stem cells? Because there was a lot of arthritis.
Yeah.
And I said yes. And it was out of pocket. But they pull it from whatever bone's right here. And it's been probably, I would say, 5-6 years. Arthritis is gone. It rebuilt the cartilage. It was a totally smart yeah. So it's a good thing.
Yeah. It's like, yeah.
Can it go into the spine, or is that too dangerous? Like, you know, people have disc degeneration and it could rebuild the cartilage.
Mm-hmm. So we do those injections paraspinal. Mm-hmm. Yeah. Yeah.
Come and inject me. I know, right?
It's like, honestly, like, so I started doing it. So this is a little bit of a tangent, but we'll keep talking about yoga. Is there another yoga classes tonight after this?
Thoroughly.
So I didn't know where to go to get them done, and so that's why we started doing them here. It's because I was like, I want to know that the product's good, and I want to know that it's like I'm not wasting my money, because it's expensive. And so yeah, we see like really great results, and like I couldn't run it all without. I could run, but then like the next day I couldn't walk upstairs or anything like that. And now I can run, like, I don't want to run super long, like 3-ish miles, and it's been great. So, and I like legitimately know I have a lot going on in that knee, like, so yeah, it's helpful, but also good motion helps like also every single other joint in your body too. Like, we'll talk about ranges of motion. And so this is the ranges of motion in your spine that everybody should have, and it should all be pain-free. So it's not super important. I'm just gonna have you notice trends, like, because you don't need to know that like you have 75 degrees of cervical flexion. That's not like really that important that you know that. And different sources say you have different amounts of it anyway. So so everybody though should be able to look down and that be pain-free. That's flexion. Extension is to look up at the ceiling. Rotation, side to side, and lateral flexion, you drop your ear to your shoulder. Okay, that's cervical ranges of motion. That should be normal and they should be pain-free. And so thoracic flexion, same thing. So this is flexion, extension, lateral flexion, and then rotation. And then it kind of looks the same for like the lumbar, right? So flexion, extension, lateral flexion, and then rotation. What you want to pay attention to is what I said before, cervical spine has the most amount of that. So you have 75 degrees of flexion, 75 degrees of extension, 35 lateral flexion, and 50 rotation. That's like the most out of anybody, right? The reason it is where it's located. It is unrestrained, so there's nothing else, not a lot attaching to it. Therefore, it means that it's also the most like prone to injury is your cervical spine, because the more motion that you can have in an area, the more also can be unstable. So whiplash, it's going to affect that anyway because it's an unrestrained area, but you have the most, can have the most injury to this area. Another example of that is your shoulder. You know, go get water. I'll be right back. Your shoulder has a ton of range of motion.
Can I use your restroom
Can I-
while you're
Yes.
Yeah.
Right here. There's only one restroom.
I'll be fast.
This is kind of a controversial topic, but on like the stem cells, have you had like urine therapy?
Are you talking to everyone in the
I
room?
mean, everyone's listening, I guess. So
What
yes,
is it called?
but urine therapy?
I haven't heard of that.
Like pee different, so you're seeing.
Yeah, urine, yeah.
That's what I thought. I know, right? It's like,
I heard if you get something like jellyfish, you're supposed to do that. But
See, that's what it comes from, because they found that through our urine, stem cells are like, there's live stem cells in our urine. And so like the idea is that urine is not a waste product, but it's like you recycle it. So people will drink their urine and to get the stem cells from it. And there's been benefits. I don't know. A lot of people in
So
Hawaii do it.
they drink it.
Yeah,
Okay.
because it's like it shouldn't have any like, as long as you're not on like a pharmaceutical. For the most part, there shouldn't be any toxins in there because it's it's ultra filtered.
You just gotta
It's
not
essentially-
think about
I mean,
what
it's-
you're doing.
Yeah.
I know,
But
right?
Yeah.
I mean, there's text in like, and I need to contact her. She was showing me way back. There's like texts, and some of the like the Sanskrit scriptures where they talk about using urine as medicine.
Yeah.
A couple things like that, but it isn't accepted
No,
widely.
No.
That's for sure.
super
Yeah,
controversial.
yeah.
It's like
But
if you get
You
stranded.
use it
in the desert,
externally too. Like
you
you'll
drink your pee, but
notice your skin gets very hydrated.
Didn't really do anything, but okay.
you have to like be a champion and like be very brave and it's like for me it's very mental.
Yeah, no, I feel you. I haven't tried it myself yet, but I have had a lot of friends that do it as practice, and like they seem
I've
pretty
been
healthy.
having.
Yeah.
And so.
Both arms.
But yeah, that's a free way to get stem cells. Yeah.
So that's why I asked about the
It's
hydration.
Oh, there's a lot of study. Yeah, for sure.
It's probably from this.
An
Well,
old
do I
thing
believe
that got
this is probably from
shielded and is coming back again. Kind of like yoga. I mean, it used to be like it just depends on where you're at, like what parts of the world you're
but
in,
it's probably from
like what's acceptable.
It doesn't matter what side you sleep on. Like if you wake up, you're sleeping on your left side. Is that what you're waking up with? On this side?
Yeah, and sometimes I'll sleep straight and it'll still go down. I've been talking to my doctor about it. She said if I'm going to go and work on it. I've had surgery.
Oh,
Six surgeries in here.
mhm.
And
On the left hand side.
both. I had reconstructive.
Mhm. Is it both hands that are going numb?
Just messing this one, but occasionally this one. But maybe she's like, I'm really tight. Like in the yoga, like when you lay down
Mhm.
and you do this, like it doesn't even.
Yeah.
I was hoping you would tell me that hydration. I could just drink more water and not fluff up those.
Oh, probably not. Have you seen like a massage therapist or anything?
I see one.
Yeah. Is she working in here?
Oh yeah, she did, and she hurt. Because I have a port scar too, and she got in there, and there's a lot of scar tissue.
I mean, I would say though that the numbness is probably coming from here too. I mean, it could be
Like
coming,
up here.
all of this could be like related, but it could, I would say also up here.
I started lifting weights. I do a weight class twice a week, so
Do you see chiropractor? What about acupuncture?
I used to do acupuncture.
I would say those two things, in addition to the massage, will probably take care of your problem.
Yeah, the person she's gonna refer me to is somebody who actually like goes in there and works on all these muscles.
Mhm.
So like this type.
Yeah. Dry needling is really popular.
I've done it, dry needling. It made a world of
What is
difference
it?
for my neck. I mean, she goes like, I think of it like acupuncture where they go in and they twist the needles. And yeah, it was huge for me, for my neck area and problems I would have, even with like dizziness and different.
Where do you do that?
Osteopathic doctor.
Some chiropractors do it. I don't do it. The therapists.
Okay.
My physical
Okay.
Yeah. Physical therapists are mostly the people that do it.
AIM acupuncture is really good, and he has his master's in kinesiology. So the owner of AIM,
I know, but who is the only person I know is Will?
his name is Travis,
Oh, okay.
but I don't know his last name. But he was awesome, and I got his recommendation through the Roby Creek race. So I tried him out, and it's covered by
Yeah.
insurance
Yeah.
too. So it's cool.
Yeah, I can dry. I just found out chiropractors can dry needle actually, and I don't.
Really? That's right. I hear a doctor on the dream. They're like, you can't. try
Oh,
to
you
do
can.
it.
No,
Oh,
I just
you
I
can.
can.
Oh, you can.
Yeah.
Oh, sorry. I
Because
thought you
we
said
can
you
do
can't.
everything that PTs can do.
Dry needling's so fun.
Yeah.
It feels so good afterwards, but it's pretty intense.
Yeah.
But it works.
I think
Yeah.
people experience it differently. It's kind of what my PT said. Like, she's like, some people really like it. Like, I didn't like it, but I liked the after. But I didn't find it overly painful. I found it odd, like odd feeling. I don't know how to describe it, but
My hands are getting sweaty just
oh, really? Was it really painful? for
really
you?
painful.
Oh gosh, yeah.
But yeah, once it releases, you're like, oh my god. But it just like
Yeah. Yeah. It's
works pretty good.
yeah. I do want to learn it. I'm like I just like to learn everything. Like if I had all the time in the world, I would just like go keep like learning things. So I do want to learn it, but it's done wonders for a lot of people. I have a physical therapist that works here, and she doesn't. She's not dry. There's like certain like requirements on dry needling. She doesn't dry needle yet, but we are going to integrate it into the practice because it's really helpful, as everybody who's done it has talked about. Yeah.
I'm gonna learn about it. So thanks, you guys.
Yeah. So what I was talking about before I start coughing is your ball and socket joint. So the most mobile joint in your body is your shoulder. So therefore, it's very easy to injure if the most mobile, hypermobile, and shoulders don't have to be hypermobile, but it's like the most commonly dislocated joint in your body is your shoulder. And it is because the way that the shoulder is, like that, the ball doesn't really fit into the socket very well. And so it's like a shallow, the glenohumeral joint is just kind of shallow and it's just kind of like sitting there. The other ball and socket joint that exists in your body is your hip joint, this one, the one that we replaced. And it's also really mobile, but this joint, this right here, this joint, where the ball fits in is like a deeper groove, and so it's more stable. You don't people can dislocate their hips, but it's more rare. But that is also a ball and socket joint. So a ball and socket joint is like one that goes around and around. So, and it can go back and forward and it can do all sorts of things. I'm talking about ball and socket joints because to me, this motion feels like a ball and socket joint motion. It's when you do neck circles. I don't teach neck circles because I don't, there's not a ball and socket joint in your neck. And so the way that like it is, like your neck is to do flexion, extension, lateral flexion, rotation, but not like circumduction, which is that motion. So if people like neck circles, I say I don't ever cross like this plane. Like, and it's taught a lot in tons of exercise classes and stuff like that, the neck circles. I don't ever teach them because anatomically I just don't think that they're a good fit. And so if like you really like them, my recommendation is to do this or to do this, which is just kind of like a more complex motion. But the like this, like for some people maybe it is comfortable to like go like this, but I just don't. The spine is not set up for that circumduction motion. People don't always like to hear that. So, but that's just my anatomical viewpoint. Thoracic ranges of motion, so you'll see you're like 25, 25, 35. And so you have more this. So if you look at thoracic versus lumbar, because they're basically kind of doing the same thing, but you have more flexion and extension in your lumbar spine. That is because the lumbar spine doesn't have those ribs attaching to it. Okay, so like the ribs in your thoracic spine limit your motion. Lateral flexion is the same. That's the half moon foot posture. That's lateral flexion. That's the same. But then notice that the thoracic rotation is 35 degrees and the lumbar rotation is 5 degrees. That is significantly less. And like basically there's like no lumbar, there's no rotation in the lumbars. Like, but like, why is that? Like, should there be? No, there shouldn't. A lot of people, the easiest way to hurt yourself and with your low back is to bend forward and then twist. It's like the worst thing for your low back. And so your low back, the way that the facet joints are angled in your low back. So the facet joints are like the joints that like the bones join together. Your facet joints, if you rotate, they actually like hit themselves. Like they're not supposed to like rotate. And so you shouldn't have, that's why it's so important like to cue people to extend first and then twist, because no twisting should be happening from the lumbar spine. So it's always extend and then twist, and the twisting is coming from your thoracics, never from your lumbars. Well, 5 degrees is coming from your lumbars. So it's not very much at all. So, and that's an anatomical situation, not a like, oh, if I just had more range of motion, then I should be able to do it, or like that's not going to happen. So so these are the plexuses that I was talking about. So this is good for your question about your numbness. So like your brachial plexus comes over out here, and then it comes down, it comes forward like where you were talking about, but it's also coming from here. So it's coming from your neck. That's why I said you should really target your neck when you're targeting like numbness too, because of where these nerves exit and then go down. This is the lumbar plexus, and that's like comes down, and like a very common nerve is the sciatic nerve right here. Like people talk about sciatica like all the time. And anytime people have like low back pain, they are always like, is it sciatica? And those nerves are like going down your low back. So tons of nerves. Like that's the main function of the spinal cord, is to protect the main function of the spine, one of them is to protect the spinal cord. And then what happens? So spinal cord injury is real bad. Nerve injury is still bad, but not as bad as like an actual like spinal cord injury. I'm gonna get into muscle, but before we get into muscles, I'm gonna go a little bit more into this.
Can I ask you a question about the flexion in the lumbar?
Yes.
So when I think about think the pose is called reverse triangle. That seems like a twist in the lumbar. Is that true, or is that twist coming from the thoracic spine?
Can you show reverse triangle?
This is what I think reverse triangle is like. I think it's this
Yeah.
one. Yeah.
So yes. So that one is if a person, you have a lot of flexibility, you have to keep your low back, like it should not be coming from your lumbar spine. But the tendency will be to come from the lumbar spine, especially if you, like, say you don't like come like out far enough, or like your hamstrings are tight or something like that, your lumbar spine is what's going to. You looked pretty straight when you were doing it. Like your lumbars looked pretty straight when you were doing it, and you looked like you were twisting your thoracic spine. But no, that pose, yes, is a really common one that people, you're flexing forward and then you're rotating, and you could hurt your low back on that one, especially if you're not warm. Like I couldn't even begin to do that. I couldn't pop up there and do that right now. Like my bones are like, or my muscles are like.
Yeah, I was gonna say that like Warrior One last night too. How like your back hip is open, and you kind of have to turn with your thoracic. But a lot of people
Turn with your.
they want to turn like their whole hips forward. Kind of.
Mm-hmm. Yeah. Ideal posture is, well, let's talk about motion real quick. Spinal motion is primarily dependent on the facet joints. That's how the joints are together. They're dependent on the size of the intervertebral discs, shape of the vertebra, local muscle actions, and attachment of ribs or ligaments. Before we get into muscles, just prefacing this, there's 700 muscles in the body, which is a lot. And you can really like nerd out. There's a lot to know. Nobody's like coming out of this as like the kinesiology major. But there's a lot of like how muscles act. That's what all this is, like this agonist versus antagonist, eccentric, that type of thing. That's all about like how muscles move. But posture, let's look at posture. There's posture. Oh, we're getting ready to really deep dive into muscles. So mountain pose is ideal posture. And with ideal posture, you have your ears over your shoulders over your hips over your knees over your ankles. That is like ideal neutral posture. Okay. And if you look at people when they're in mountain pose in your class or in the yoga class that you are at, you'll notice lots of different things. And like I said, most of the time it's like people rounding forward, people like this, people not having their foot straight, they'll have it out to the side, or you'll have people. I tell people to put their ankles over underneath their hips, and it's like people will be like this. And I'm like, well, that wasn't quite the cueing. I teach for Boise community education. So it's people that normally maybe have never done a yoga class or something like that. So I see a lot of different things. But this is like ideal neutral posture. So also things that you'll see is one shoulder being higher than the other. That could be muscular, or it could be something with scoliosis. You've been talking about curvatures that are front to back. You can also, one of the dysfunctions in the spine is to have scoliosis, where it's like this, and this is obviously a really severe case. But like people can have, instead of the spine going up and down, it goes to the side. And these people generally have a lot of pain because you've got muscles pulling on this side, muscles stretching on the other side. It's not the most comfortable. Motion definitely helps people with scoliosis. And yoga is really good for people with scoliosis. So you'll see people, like some people have a hip people can have a hip that's higher than the other. Sometimes that's seen with scoliosis. Sometimes people have an anatomical short leg. And then also like head tilts side to side. That scoliosis is the last one. So you can have postural distortions that are like seen on this plane, and then you can also have postural distortions that are seen on the side plane. And that's like, I would say a lot of people have like in an aging population, people have kyphosises. And so that means this person like this is gonna, it will be impossible for them to lay on their back. And it's impossible for them to like come to a wall and do like wall angels, like, and get their arms to the back because the kyphosis is bigger and it's pushing them forward. So people can also have like really straight spines. I do see this military posture that's on like the 5th one. I see that a lot in when I take x-rays of people. You can't always tell like these people have like forced their like almost double chin themselves to having good posture. And then you can also get people that have more of like a flat spine, that they don't have a lot of curvature in their spine. These people have a lot of pain too. It feels like I was talking about before, like a pogo stick kind of like effect. So you want to have these good like curves, and the yoga postures help you preserve those good curves. So these, and I'll show you some pictures of like, I just gave you some like things that like poses that are do flexion, poses that do extension, lateral flexion and rotation. There's also, yoga is really the only one that talks about this range of motion is axial extension. So that's like lengthening your spine, like, and I think Debbie, if I remember correctly, is like, oh, there's a string on the top. Does she still do this one? There's a string on the top of your head that's like pulling you up towards the ceiling. That's like axial extension. So that's like lengthening your spine. That is, you can also get it from activating the bandhas, but axial extension is just like creating length in the spine is axial extension. And Leslie Kamenoff, which is kind of like old school father of, he has a book, and in that book he talks about it. I've also brought some books that I recently reorganized my entire life. And so I have probably like 30 yoga books that are related to anatomy and things, but I'm just going to take a quick before we get into muscles, because muscles get felt to be a lot. This one has a lot of pictures. It's nice. It's not really like yoga anatomy, but when I was talking about what I was talking about to Debbie, she was like, oh, this book is great. I like this. If people, I don't know what you're doing with yoga, but this yoga as medicine is really interesting, like yoga therapy. So like treating specific, if you're like, oh, this is like, I want to treat specific things with yoga. Like this is a good book because it's like treatment specific, and it was written by an MD, and so it's kind of interesting. I like books. But
Who was it by?
this is by Timothy McCall, and it's called Yoga as Medicine.
Yoga of Medicine.
Yoga as Medicine.
And then his name one more time.
Sure. Timothy McCall.
Thank you.
I like books with pictures too. Ray Long has a good book with pictures. He has multiple books that are like this, and you can tell. I like them because you can tell exactly like what's happening in the postures with the muscles. So, and like which muscles are contracting. Anytime you contract a muscle, you stretch another one. So like if you contract the bicep, you stretch the tricep. I'm just using that because it's like a really simple like thing. But this, if you're like into muscles, and there's some of them. So if you're into muscles, the Ray Long's books, I think, are like the best ones. People who are teaching, and this doesn't necessarily have to do with anatomy, but a little bit, is this also has, if you're like treatment focused, yoga sequencing, designing transformative yoga classes, also has some treatment specific things in it. But I struggled when I was first mapping my classes, and I still actually refer to this book for my sequencing because it's a visual, like you can get stuff from, I mean, a lot of things are video based, but this yoga sequencing book is a visual, like I can see the postures, see what to do. It was really helpful in my like designing classes, and it gives you like a physical something you can hold on to and look at. I just, for me, it's harder to like look up, but maybe it's, I'm 40, so maybe it's my generation, but like looking online and like trying to piece together something, or even like watching videos, like it was really helpful for me to have this. I don't anymore, but I'm actually getting ready to resubscribe to it because I haven't found anything that's like it. Is Yoga Glow, Yoga GLO, and they have tons of classes, tons of courses. It's a really good resource for yoga teachers, and I want to say it was like, I don't know what it is now. At one time, it was like $18 a month, but class sequencing, if you want to focus on something in your class, being able to like, because I've done yoga forever, not forever, 20 years, but it's can be hard to remember what you did after you leave the class. And so the videos are really helpful. So, and it's a paid service, so it's really high quality. Now we'll get into muscles. Yes.
So my one friend, she has like fused discs, and I guess her doctor told her not to practice yoga. I don't know. I've never heard that one person. I just why? Maybe just to be careful.
I would have to know like where those discs. Do you know where they're fused?
I want to say like.
So surgically got fused.
Yeah.
Yeah.
She had an injury.
Yeah.
So,
Snowboarding injuries. Snowboarding and sledding. So
she wants to, but it was when she was a teenager too, so it's been a long time since her injury, but she wants to practice, but she's like, I'm not supposed to.
I don't know, but that also might be kind of older advice too, like from her surgeon. I don't know, like it's hard for me to give like specific advice because I can't see what's happening, like what. But I'm just gonna use. I have a patient, and she had really bad scoliosis. So it's not quite the same, but she has rods like from her thoracic spine to her lumbar spine, like complete like rods. That so like if you have really bad scoliosis, it looks like this. The worry is for some people, if it's compressing too much, it starts to affect the heart and the lungs. So you don't want that. And so doctors will go in and they'll put rods and they'll go from here to here. And this girl does Thai yoga like multiple times a week. Like, but I don't know your friend's specific case. And so for her, I would say that might just be really older advice. Like if this happened when she was a teenager, I don't know. I don't know how old is she now? It's not that much. It's 10 years, maybe. I don't know. I would
My thought is they just didn't, like, if you did yoga, you would just need to know what you have to be really careful. And so instead of saying, be careful and get somebody, just don't do it. Is my guess. And if you could find somebody that would work, like, keep her safe,
right,
knowing anatomy, then you shouldn't do these, or when you do these, you.
For sure.
But yeah.
So like some people get into yoga and they do like yoga therapy, like where like I know this a woman in the community that's like her practice. Like she would meet with this person likely like one-on-one and just be like, these are really good for you. This is what you wouldn't do. She's not a doctor, but like that type of thing. Like, again, I'm not giving your friend advice right now.
I just haven't heard that before.
Yeah, I mean,
So I think it would be maybe good to, I don't know, to practice for her.
So, like-
at least, and-
so I guess maybe the worry is, I don't know the
Yeah.
whole situation. However, like, so let's pretend like if this was me, okay, and my back is fused, this entire thing is fused back here. You still want to move your hips and you still want to move your thoracics and your lumbar. So regardless, like of like this part, so I would still want to like maintain both movement in my neck and my thoracic and my pelvis, because anything what I know about fusions is the area above and below it are specifically also vulnerable to more degeneration because you aren't moving those areas. So, or you're over moving them. So I would say that for me, if I had a fusion in my low back, for example, I would still be fine practicing yoga for myself, because I would be like, well, I gotta move here and I gotta move like above it and below. I gotta move above it and below it more so than I like needed to, because if I just stop moving altogether, like it's gonna cause more issues. So that's how I feel about it.
I mean, and she still like hikes and bikes and snowboards.
But I'd be like,
still.
can I do Cobra? Can I do
Yeah.
like I wouldn't know any of that.
Yeah, I mean, she should be able to do all those things. Like,
Yeah, that's why I thought it
Just
was
like
odd,
the
'cause she's
body.
very like active still, and I think
There's
well,
Like
what you
if
said.
you're active, you know,
I mean, I would feel like
Do it.
Yeah.
it depends on where it is. Like, honestly,
Yeah.
like maybe like back bends would be like more of a caution. Like, maybe like complete forward bends. Like, you know what I mean? Like, in my mind, like when I'm like flexion and extension, like pushing it to a limit would be like, then maybe more of an issue. But
I know my mom has had a couple of fusions in her neck, and they do tell her like range of motion, right? Like just don't push it, but it's not like you can't do it, right? But you have to just know your limits. I think, yeah.
maybe like misconceptions on yoga too.
Yeah,
like
well, not all yoga is the same.
Yeah.
You know, like I also don't. I am not a headstand proponent, and so that can be controversial. But I will just tell you why, and then you can make decisions for yourself or for your people in your class. So with a traditional like headstand, all of the weight of your head is balanced, or all the weight of the entire body is balanced on the top of your head.
That looks really bad. I never looked at it that
So
way.
I am uncomfortable with this from a biomechanical perspective, because I don't understand like how, and I didn't say invert, I can understand how inversions are helpful, okay? But I cannot biomechanically understand why this specific posture with all the weight of the head on it is beneficial. Because I just don't, unless you're like a very specific person that has a lot of strength and you have a perfect cervical curve, like in your neck, which most people do not, even people that look like they're super fit. I've taken x-rays of people who I would have thought like they have perfect posture, but they're, instead of a C-shaped curve, they're doing an S-shaped curve in their neck. I've seen that. There's some people that maybe I'd be like, yes, you are cleared to do headstands, but those people are like super few and far between. And just like, I don't, there's this much weight on that area. It's just hard for me to like picture that being like, I just think that risk of injury is high is really, really high. And then you're also like loading these discs more. Your mom had a fusion likely because she was having terrible pain down her arm, I would assume, maybe.
Bone spurs, like
Bone
fibromyalgia
spurs.
or
Yeah. Like just that amount of weight on these discs, it's not to me like a risk that I would like. I did it a few times like in Iyengar and when I was in my 20s in yoga school, and I was just like, I don't see like the benefit to this. The other thing that happens in your cervical spine is this artery runs down through the bones, and you can messed up in headstands and shoulder stands. It's when you like hear horror stories about the chiropractor, this is the artery that they're talking about. The vertebral artery, it's the same one that like if you go to the hairdresser, there's a risk, and you put your head back in the bowl, there's like a risk of that. So vertebral artery dissection is what I'm talking about. So like you never want to turn your head and be in a headstand. I don't know why you would do that. Plow can be a risk, like for vertebral artery dissection.
Die when that happens?
You can die. You don't always die, but you can.
Or like if you turn your head when you're in bridge, that's pretty.
You shouldn't turn your
Yeah.
head in bridge. Yeah. Yeah. Anytime you're bearing weight on your neck, you shouldn't turn your head. That is just good life advice. I don't know. I don't recommend it. Okay. These are the big muscles. So I'm going to focus mostly on the muscles that are in the back and of the spine. So you have your trapezius muscle, which is a really big muscle, and these are the most superficial is your trapezius and your lat. Your lat is like the biggest muscle in your low back is the latissimus dorsi, and that comes all the way down from like attaches into your side joints, and then it comes in and attaches into the arms. It's like your rower muscle is your latissimus dorsi. Your trapezius muscle is really hard to kind of access, and so you can integrate this into your yoga practice or into your teaching. I find them valuable. This is a 4-part stretch for your trapezius. So because it's a triangular muscle, so if you bring your elbows to an L and you bring your shoulder blades back and together, that gets this area right here. T gets this middle part. W gets this part. And a Y gets this part. So I'll do them again. So you get an L, T, W, and Y, because the way that this trapezius muscle is, like it attaches here, it attaches up at the base of the skull, comes over, attaches into the arm, attaches like a T7, no, it's like T7 to T12, it's like a kind of a long range, and it's just an oddly shaped muscle. And so this is a stretch, it's strengthening for the trapezius muscle. Most of the time, people's trapezius is, most of the time we're doing this, right? So like building this muscle will help people with their posture. I was presenting on a panel and with a PT, a physical therapist, and some other people, and I taught that stretch, and he's like, I've never seen that before. It's a good one. So this is just to show you like kind of how complex it gets. So like your latissimus dorsi is here, your trapezius muscles here, and then you peel all those, there's just like layers upon layers upon layers of muscles. The next big ones are kind of like these erector spinae muscles. Those keep you posturally like upright. You've got the levator scapula. That muscle comes in, it attaches from your neck to their scapula. So it's one of the muscles that when like bring your shoulders down and away from your ears, that's one that like you're having to bring back and down. Underneath the trapezius is like the rhomboids. Those bring your your shoulder blades together. These are all like postural muscles. There's a ton of them. And it just gets deeper and deeper and deeper. So, this is the trapezius. So it does so much. It's mainly postural, but it's also used, the trapezius is also used for active movements such as side bending, rotation of the head, elevating and depressing the shoulders, and internally rotating the arm. And it elevates, depresses, and retracts the scapula or the shoulder blades. This is the latissimus dorsi. It is this muscle. I will say, if you've ever had low back pain, that even you're like, when I move my arm, I have low back pain. That the latissimus dorsi is probably involved in that muscle, and this because it's a low back muscle that actually inserts into the arm.
If we have weights accessible to us during our yoga practice, is it recommended to add weights for a movement like this to build muscle faster since there's resistance? Or
I mean, I don't really see weights in yoga specifically, but you could use weights in your own personal yoga class. Is it still yoga? I don't know, but but this would help you build, weighting it would help you build muscle faster. Yes. These are some of the muscles in the neck and their actions. They rotate the head and they work together to extend the neck. So they rotate and extend. Most of the muscles, if you have a deficiency in a motion, most of the time it's more than one muscle that's implicated. And muscles, it can be hard to pinpoint on your own because muscles have multiple actions. So multiple muscles cause the head to extend back or laterally flex. These are a little bit deeper, and these are the erector spinae muscles. So you kind of peel back all these layers, and then these muscles, and so these muscles span the length of your spine. So people with neck pain can have low back pain because the whole area, it's the top to bottom, these muscles run. And then in between the vertebra, these are all the little muscles that are in between, and those cause, so you have global muscles that cause movement, and then you also have individual muscles between each of the vertebrae that also move things too. So there's so many muscles in the low back, and these spinalis, longissimus, and iliocostalis, these are the erector spinae. They keep you erect. They make your spine straight, and they flex and extend and laterally flex the spine. So just big, long muscle groups, lots of muscles. And then their deepest ones are located underneath the erector spinae and are known collectively as the transverse spinalis. And they are a group of short muscles, and they go from on here, they go from the spines process to the transverse. So if you're looking on a model. And there's three major muscles in this group: the semispinalis, multifidus, and rotatorus. Just gonna click through here. The multifidi muscles, they run down your entire spine, so they're in the low back too. Muscle weakness can cause low back pain. These are the rotation muscles, the rotatoras. They're the deepest ones. Okay, there is that. Lots of muscles. You could really nerd out on muscles. Let us talk about.
Who's that cute little one?
That is my daughter Hazel. She's a little bit younger than this one. I don't know if I had her new photo up here, but disagree. Okay, so that is Hazel. She's now 5. Okay.
It's a goldfish.
Yeah. This is a neck x-ray. So this is disc spaces are equal and this is normal. This is the front, this is the back. That's like good, like posture. That's a healthy cervical curve. This person can do a headstand, okay? This is healthy low back x-rays. So like good disc space, this is the front, this is the back. The hips are like this is the ball and socket joints right here. And these are your true hips right here. This should be straight and this should be straight. If not, if you have a side to side deviation, that's scoliosis. That's what we've been talking about. Some of this is just like refreshing. So healthy spine, bone spurs, narrow discs, that's like your osteoarthritis. This is an MRI. So this is a herniated disc. This is a degenerated disc, and this is a normal disc. This 100, what we've been talking about water, so I'm just pointing this out. Degenerated disc shows less water content. So like I said, hard to just drink water and make it happen. But that's an MRI of a spine. You're probably not going to see people's MRIs when you're teaching them yoga, but at least maybe if somebody says something to you, you can be like, oh, okay, that makes sense. This is arthritis, bone spurs on an x-ray. So like in the disc narrowing, what that looks like. This is like more bone spurs. This is like more, like this would be like kind of like mild to moderate arthritis, and this would be like severe. Like you can't really see the disc spaces. This person generally has more pain. They have more pain in the morning. They might have more pain, like if they were to go for a run or something like that, they would have more pain. These are examples of posture, good posture, and the different types. This is a person that he was seeing us for chiropractic, but he was also coming to yoga. And this was his first picture, and you can see on that red line that like his head is forward out here. And with treatments and with coming to yoga, his foot still turns out at the bottom, but like his posture in like general is like so much better. So like this is also gonna make like he's older, if you can tell from the picture. This is gonna make a person like healthier and like less of a fall risk too, which is super important. This is another person who was doing a program with us, and you can see the forward head, so the ears are over the shoulders, and then afterwards it was like straight, so the ears are over the shoulders.
Are all of these combination chiropractic with yoga, or some just chiropractic?
This one was just, the first one was chiropractic and yoga. This one is just chiropractic. And dinner roll, which is not a dinner roll, different thing, but where they would lay on, and I can show it to you, you lay on this block, like kind of like foam block, and it puts the curvature back up your neck. Yeah. As well as like I said, with exercises too. Yeah. Oh, this is that F-shaped curve I was talking about, in case somebody wants to look at it. And this is how you don't know. Like this person looks like they should have, like this person would have good posture because their C1 is over their C7. But this person should not do headstands because they don't have a good curvature in their neck. So like it would just be more like stacking, which would not be ideal.
So that's really straight. That picture is straight.
Yeah, it's actually an S
It's
shape.
like the other direction.
Yeah, because this one's super straight. This one's a straight, what I call a straight neck. It's like out here, but straight necks are always like this, like forward too. This person is like an S shape, which puts more like stress and strain, especially specifically like right there. This is just good flexion. This is good what it looks like. This is what it looks like when you're moving. This is a lot of times I see. So this is like good healthy motion to the side. This is good healthy lateral flexion. This is somebody trying to do the same thing, and that is like not like moving well at all. That's like terrible range of motion. Yoga will help with that. Then that's left lateral flexion. Gosh, it's a terrible one. I don't know where I got. This is like a good bones, like in your lumbar spine, like a nice curve. Everything looks good. I don't know if you guys can see this one. This one is like the L5 is slipped forward in front of the sacrum, or in front of, sorry, L5. Yeah, L5 is like forward. That's called a spondylolisthesis. If somebody says you have a spondylolisthesis, those are people to be like, to inquire more. They probably know that they have it and probably know what they should and shouldn't do. But those people have a lot of low back pain. But those, I would say your friend is fine to do it. This person with this x-ray, I don't think that they would be fine to do all of yoga. This is an example of scar tissue. So say somebody's like, I have scar tissue, I do yoga, I have scar tissue. This is an example of a tissue that's never been injured. Scar tissue affects not bones. It affects muscles, tendons, and ligaments. It's not a bone thing. Scar tissue, that's like, so healthy tissue has like nice grid shaped patterns. It looks pretty. An injured tissue or strained tissue gets essentially like tears in it. But what rebuilds is actually stronger than it was before, but it doesn't have like a nice grid shaped pattern. It may not glide the same, it might not move the same, but like absolutely scar tissue should be moved. Like just like letting scar tissue be is not a good plan. So people who have scar tissue can definitely do yoga because scar tissue inherently decreases your range of motion. And so yoga will help increase your range of motion. This is my tendon versus ligament conversation that we were having earlier. Bone, and then the tendon attaches the muscle to the bone. And then ligaments are just bone to bone. These are like, I highly suggest looking at like good versus like poor alignment, because this is like kind of injury like waiting to happen with how much like rounding is happening in this girl's lumbar spine, and like the like learning the variations to like support good like spine health, because most people like are really like tight in their hamstrings, so they're not able to like do this posture well, but like the ability to have a block is going to make all the world of difference in like keeping the spine straight, because like before it's like around like rounding, I don't know what, well, I mean it's just not supposed to round that much.
That looks like my husband when he tries to touch his toes.
Right.
The top picture.
Exactly. He needs a yoga block.
Okay.
Yeah. Revolve triangle. We have spoken about this. I thought I had it in here, but I couldn't remember. So like you want to lengthen the whole spine away before you twist it, because this is a recipe for low back injury, is that forward fold with the rotation. Okay. So same here, like, which is hard for a lot of people to do, but like keeping the spine straight and versus like rotating down, like is crucial. Flexion, I cannot impress, even if it's just for your own practices, no flexion and rotation, or try to keep as long, like your spine as lengthened as possible before you rotate.
Can you remind us what flexion means in a pose?
Sure. For your spine, and I'm just going to say it in your spine. So flexion is for this forward, like folding.
Okay.
So in your spine specifically. This is flexion also. Okay. But let's just talk about your spine. As flexion is this forward leg. So most of the time, this is a generalization, but most of the time you want people to have long spines, like lengthen their spine in whatever posture. And that's like the only thing that you take from today, is that people having length in their spine is better than people having like lean forward. Not like that is like the goal. I mean, one of the goals of yoga is to create length in your spine. Like,
Before you move into a posture or move deeper into it, if it involves your spine, lengthen your spine. That should be the very first thing you do before you even move on to any. So if you're bending over and you're not engaging, you'll end up like my husband probably.
even into a back bend. Why is it always cute? It's always cute to lengthen and then extend.
Yeah.
Always. Always. And that's why. You always lengthen first. Because you really don't want to enter things in femoral flex.
Does that engage the muscles? Is that what, or does it put the
It
bones
takes
in
it takes you into more neutral spine if you lengthen. If you lengthen first, it gets you into more neutral spine.
How do you lengthen before a back bend if you're on your back? I'm not understanding what lengthening before a back bend means.
Like so like if you were like if you're like in camel, for example, you would like lengthen, like you would like extend first, like try to lengthen yourself up as much as you can and then go back. So you're not collapsing and like falling into your low back. So you're like lengthened and then you extend.
Okay.
He always
Like
says
how-
inhale, lengthen, and then she's exhale. So she always keeps.
Yeah. So if you same with twisting.
Yeah.
So if you inhale first, it automatically lengthens you. So you could say that if you want, or in your head, say that, or when you're teaching, say that. Inhale, and then